What is the mechanism to request financial assistance?
Starting in January 2025, UNHCR has partnered with Yayasan Relief Islami Indonesia to provide socioeconomic assistance. However, please note that our financial assistance for 2025 is very limited and we have a reduced capacity compared to our program in 2024 and also in previous years. You can reach the hotline through WhatsApp 0878-1549-5259. That's the hotline of the Yayasan Relief Islami Indonesia. After contacting the hotline, your case will be recorded and added to our long waiting list. Your situation will be assessed by our partners, Yayasan Relief Islami Indonesia for Socioeconomic Support and Yayasan Cita Wadah Swadaya or YCWS for health assessment. Unfortunately, we cannot predict the waiting period for the assessment by our partners, as it can take quite a long time with our very limited capacity. Once the assessment is completed, the case will be brought to assistance panel meeting attended by UNHCR and our partners, YCWS and also Yayasan Relief Islami Indonesia. The panel then will decide whether or not your case will be granted financial assistance according to our eligibility criteria and funding availability.
Will the assistance for those whose MSA was cut last year resume this year?
It is unlikely that we will be able to resume assistance for those whose MSA was cut last year due to our funding situation. Given the current circumstances, we must provide the most vulnerable individuals with assistance. We encourage everyone to seek out other opportunities, financial resources, and support from different sources.
How do I qualify for health assistance and why might I not be eligible?
We recognize that addressing the health needs of refugees is a challenging issue. We understand that limited access to healthcare can cause significant distress. Due to budget constraints, UNHCR and our partner, YCWS, must prioritize the most severe and life-threatening medical cases. We are committed to ensuring that our resources are allocated to those with the most urgent needs. For emergency cases, please understand that these conditions are considered an emergency. Difficulty breathing, loss of consciousness, moderate to severe bleeding, ongoing or prolonged seizure, premature rupture of membrane, broken bones or fractured, fever more than 38 degrees Celsius more than 3 days, for children, diarrhea more than 5 times, heightened risk due to non-concomitant illness age, moderate to severe dehydration, self-harming, and other mental health issues. Other criteria for assistance are life-threatening emergencies, severe mental health problems, for example, schizophrenia, major depressive disorder, PTSD, etc., acute complications of chronic diseases with considerations of prognosis, newborn medical care and maternal care, basic immunizations, physical examinations, investigation, medical follow-up, and psychosocial care for survivors of gender-based violence.
What specific plans does UNHCR have to establish a sustainable health system that adequately addresses the needs of refugees suffering from chronic illness?
While continuing our current health assistance, we are dedicated to advocating for greater refugee access to national health care and health insurance through policy engagement. We recognize that achieving systematic change is a gradual process dependent on various contextual elements.
How is the referral pathway of health assistance for refugees?
For emergency in Jabodetabek, call the health hotline at 0811 8161 511 and describe the health concern to the officer. If deemed an emergency, you will be referred to the nearest partner hospital's emergency room with prior notification. For non-emergencies, your request will be recorded and it will be screened in the YCWS help desk the following Monday. For non-emergency in Jabodetabek, begin by seeking treatment at your nearest puskesmas. If the doctor determines advanced care is needed, they will provide a referral letter based on medical assessment, not patient requests. Submit this letter via WhatsApp to the YCWS Health Hotline in 0811 8161 511. YCWS will then assess the referral based on our internal guidelines to determine support eligibility every Monday. Requests received after Monday 12 p.m. will be processed the following Monday. For outside of Jabodetabek area, due to resources constraints, YCWS is currently providing direct assistance only within the greater area or Jabodetabek. In field locations, we may be able to support emergency medical cases. We kindly request that you first seek a diagnosis at your local Puskesmas. If your condition cannot be treated at the Puskesmas, please consult with UNHCR staff in your area. This will allow us to assess whether UNHCR can provide further assistance. For further detail, information on Puskesmas address, relevant hotline numbers, and referral mechanism, please visit our help website.